Here are Puerto Rico Medical Board-style clinical vignettes focused on cell cycle regulation, featuring 4 answer choices and detailed explanations for each. Clinical Vignette 1. Role of P53, a 55-year-old man with a history of smoking presents with weight loss and hemoptysis. Imaging shows a lung mass, and biopsy reveals squamous cell carcinoma. Molecular testing reveals loss of a gene that normally arrests the cell cycle in G1 in response to DNA damage. Which gene is most likely affected? ARB, B, BRCA1, C, P53, KRAS. Answer. Explanation. XP53 is a tumor suppressor gene that halts the cell cycle at the G1S checkpoint when DNA damage is detected. It also promotes apoptosis if damage is irreparable. Loss of P53 function is one of the most common events in human cancers. Clinical Vignette 2. RB and cell cycle control. A 2-year-old girl presents with leukocoria, white pupillary reflex. Fundoscopy shows a mass in the retina. Genetic analysis confirms a mutation on chromosome 13q14. The defective protein normally binds E2F transcription factors. What is the normal function of the affected gene? A. Promotes G1 to S phase transition. B. Halts cell cycle in G2. C. Inhibits progression from G1 to S phase. D. Induces DNA repair enzymes. C. Inhibits progression from G1 to S phase. Explanation. The RB gene encodes the retinoblastoma protein, which regulates the G1S transition by binding and inhibiting E2F, a transcription factor necessary for S-phase entry. When RB is phosphorylated, E2F is released, promoting progression. Clinical Vignette 3. Cyclin CDK complex A. 22-year-old man with a rare genetic syndrome has defects in cell cycle regulation, resulting in unregulated G1 S-phase progression. Which of the following molecules forms a complex with CDK4 to promote cell cycle entry? A. Cyclin A. B. Cyclin D. C. Cyclin B. D. Cyclin E. B. Cyclin D. Explanation. Cyclin D binds to CDK4/6, forming a complex that phosphorylates RB, leading to E2F release and progression to S phase. Cyclin D is critical for passing the G1 checkpoint. Clinical Vignette 4. CDK inhibitors. A mutation in the CDKN2A gene is found in a family with a high incidence of melanoma and pancreatic cancer. The gene product normally inhibits CDK4/6 activity. What is the protein product? A. P16, B. C. Cyclin D, D. E2F. Explanation. CDKN2A encodes P16, a cyclin-dependent kinase inhibitor that blocks cyclin D CDK4/6, preventing phosphorylation of RB. Loss of P16 allows unchecked progression through the G1S checkpoint, increasing cancer risk. Clinical Vignette 5. G2M checkpoint. A cancer drug is designed to block cells in the G2 phase by interfering with cyclin CDK activity required for mitosis. Which cyclin is essential for promoting mitosis entry? A. Cyclin D, B. Cyclin E, C. Cyclin A, D. Cyclin B. Add explanation to CDK1, also called CDC2, to form the maturation promoting factor, MPF, which is essential for the transition from G2 to M phase. Drugs targeting this complex can arrest mitosis. Would you like to follow up with a set of tumor suppressor focused